Hello, my name is Hannah Bessiata, and I am a DNP student at the College of St. Scholastica in Duluth, Minnesota. The purpose of my DNP project was to examine the interactions of medications and traditional medicinals used by Native American patients. While this information is important to all healthcare providers, it is even more pertinent to those providers who interact with Native American patients routinely. This material is geared more towards the Anishinaabe peoples of Minnesota, but provides awareness for healthcare providers working with members of other tribes as well. While there are hundreds of years of history bound within the background of this topic, we will discuss only a few key points. Since time immemorial, the indigenous populations of the world have discovered, explored, and applied traditional ecological knowledge, or TEK, as remedies to human ailments, as referenced by Genius 2009. In the United States, Native Americans have employed the bounties of traditional medicinals, or TMs, incorporating these medicinals into their physical, mental, emotional, and spiritual realms. Western biomedical healthcare rarely esteems the value and practicality of traditional medicinals and thus minimizes this important strategy in holistic healthcare. This alienation of TEK depreciates the contributions of indigenous peoples to the medical community and creates distrust between its practitioners and healthcare providers. Healthcare providers must be aware that traditional medicinals are potentially dangerous substances, especially when used in concurrent with medications. Malkhadam et al. 2013 and Wentingon 2012 related that the historical trauma and persistent discrimination experienced by Native Americans destroys the trust and transparency necessary to traverse the biomedical healthcare system. Without transparency, i.e., the education to inform decision-making, there can be no trust. Without trust, Native American patients are sometimes left to the mercy of their healthcare providers who may not look beyond the physical ailment. The lack of trust and transparency leads to the lack of disclosure of TM use by Native American patients who already experience discrimination within the healthcare system. According to Esposito and Conjon 2020, the aforementioned lack of trust and transparency places Native American patients at greater risk for adverse drug and medicinal interactions as compared with any other population groups in the United States. Unwittingly, these individuals may ingest medications and TMs, which can cause severe adverse interactions. Further, these policies and exploitations have rendered significant health disparities for Native Americans in the areas of heart disease, mental and behavioral health, diabetes, chronic liver disease, and stroke, according to the Office of Minority Health 2021. There are a few examples of potentially critical interactions between traditional medicinals and medications. Goldenrod is used for bladder and menstrual disorders, but it has a potent diuretic effect, according to Hutchins 1992. Concurrent use of goldenrod with Lasix or spironolactone exacerbates the diuretic properties of the individual substances and risks damaging the renal system. Patients with heart failure often take beta blockers to reduce cardiac workload by lowering blood pressure and heart rate. Persons taking TMs may take hellebore as a sedative or pain reliever, according to Hutchins 1992. Hellebore can cause profound bradycardia, such as a heart rate as low as 30 to 40 beats per minute at recommended doses. While hellebore has dangerous side effects as a solitary agent, combining it with a beta blocker can induce cardiac arrest. Lastly, swamp milkweed is boiled by Native Americans and used for asthma, bronchitis, and respiratory influenza. However, the latex from this plant contains cardiac glycoside, the primary active agent in digoxin. If the patient takes digoxin for heart failure or atrial tachyarrhythmias, the synchronous use of these substances greatly enhances the risk of digoxin toxicity and the pursuant cardiac arrhythmias and cardiac collapse. With such monumental tasks of achieving health equity among Native Americans, advocating for patient autonomy, and creating an inclusive environment in which Native American patients feel safe and confident to disclose their use of traditional medicinals, healthcare providers have the unique and exciting opportunity to influence Native American healthcare through very simple changes in practice. Native American patients do not regard traditional medicinals as herbs and supplements as they are perceived in Western healthcare. Herbs and supplements is a colloquial term used in Western medicine, which refers to any commercially produced product which is marketed and consumed for presumed health benefits. However, traditional medicinals are considered medicines in their own right in the Native American culture, with specific traditional medicinals being central to each tribe. Further, Native Americans believe that considering traditional medicinals as anything less than medicine robs the power of the medicine to heal body, mind, and spirit for the individual who receives and uses the traditional medicinal. By reflecting the terminology used by a Native American patient, a healthcare provider can create a welcoming environment and dialogue with which to discuss the use of traditional medicinals, as well as the potential interactions of traditional medicinals and medications. With more complete patient education, the Native American patient can choose which types of healthcare best supports their physical, mental, and spiritual well-being. To be clear, this policy recommendation does not endorse healthcare providers prescribing or distributing traditional medicinals, but rather using this information to stimulate conversation regarding traditional medicinal use among Native American patients. Healthcare providers should specifically ask Native American patients if they use traditional medicinals. In conclusion, the overarching purpose of this project was to reduce the risk of adverse outcomes to Native American patients who choose to use traditional medicinals by creating a sustainable and welcoming environment and focusing on establishing trust and respect between healthcare providers and Native American patients through engaging in culturally sensitive and culturally specific conversations. Lastly, this project seeks to educate healthcare providers about potential interactions of TMs and medications in order to increase awareness among providers and encourage them to offer Native American patients informed choices regarding their healthcare, thus promoting self-agency and patient autonomy. This project aims to achieve these goals through enhanced and holistic training for healthcare providers to help them integrate and value Native American culture and traditional medicinal use. The references listed here are provided in an easier to read format within the toolkit.